at NTV.
Welcome back to Morning at NTV. Now in our conversation this morning, in case you're getting yourself a copy of the Daily Monitor or any other particular newspaper this morning, you will see that the cases within the country have actually risen. The cases of COVID-19 currently stand at 1,140, I beg your pardon. Cumulative cases as of yesterday, the Ministry of Health did release a press release in which they confirmed that right now there were 5 new cases. Now later on today at about 11 a.m. the Minister of Health will be addressing the nation. But for now we're going to be having a conversation about the pandemic, the COVID-19 pandemic. There was a particular amount of money that was given to a group within the country to help with what we would call scientists doing community and public engagement to build resilience against pandemics such as COVID-19. Now joining us to have this conversation this morning, I'm joined by Dr. Daniel Semakula, who is from Thrive. Welcome to Morning at NTV, Dr. Daniel.
Thank you so much.
Now we'll start off with what you were teaching me earlier on as I was trying to put on my face mask. It's a surgical face mask, and Dr. Daniel tried to give me some education on this, and perhaps he should give us this before we get into that conversation, because this is also a part of public engagement. How should someone put on their face mask?
Well, it depends on the type of face mask one has. For those that are putting on the surgical ones, there are different sides of the mask. So one of the sides is colored, could be blue or green. The other side is white. So depending on the manufacturer, I think most of the masks, surgical masks that are currently available on the market, tend to suggest, or the recommendation is that it's the white side that should be inside. But whichever mask one has, they actually need to reflect on what the manufacturer says about that mask. Of course, there are also cloth masks, and the ones I've seen on the market are pretty straightforward. Most of them are shaped according to some kind of face, and it sort of makes it easy for one to wear because it tends to be pretty straightforward which side should actually be inside and which side should be out. But the issue we're talking about is which side should be up and which side should be down for the surgical face mask. So for those that are wearing the surgical face masks, there is a side that has a metallic, something metallic. That side should actually be up, and the reason for that is because you can actually use it to mold the mask around your face. So that should be up. So if I pulled mine like this, I can mold it around my nose so that it actually sticks better. So that side should actually be up and not down.
Well, now you've definitely learned that you can actually be able to mold the mask to your nose. I'm going to try that on later on. Now, as we speak about this morning, why I'm wearing a mask, why he's wearing a mask, is that the cases are actually going higher in the country. We have recorded 2 confirmed deaths of COVID-19, and from one of the dailies, it says that the surge of cases is there. Now, one of the things is that they're within the community, but there's what we would call science, community, and public engagement. All these terms, public engagement on its own, but where does science and public engagement come in? And we'll start from there, Doctor. Let's talk about how do you apply science to community and community problems at this point in time dealing with the pandemic? How do you do that?
Well, thank you for your question. So you might have heard, those that have been listening into the presidential addresses, you might have heard the president referring to the scientists or the science or statements of the kind. What he's trying to mean is that he is trying to use some kind of evidence to approach policies and directives that are given out to the public. So what essentially that means is one has on one side evidence from research, and on the other side, you have people that could benefit from that information. And those two need to, find a point where, they can meet. Those that generate research and those that need to use the research need to meet at some point to interact, understand that research, and then be able to use it. So far, what we've seen in the past is, I'll give an example of HIV, where research was done, and from that research it was demonstrated that you can actually prevent mother-to-child transmission of HIV using medicines, using drugs, ARVs, and so that had to be operationalized into some kind of policy. We've seen the same with malaria treatments and prevention, as well as mosquito nets and things of that kind. So when it comes to COVID, you also want to make sure that the policies you're giving out, the directives you're giving out, are based on some kind of information that is reliable, which has been collected systematically, and if collected again in that manner, can actually be replicable, meaning we can trust that it won't change much regardless of who is testing, as long as they use the same methods. And that is what people tend to term as science. So community and public engagement is sort of the bridge between what scientists know to be true from research, from the knowledge that is generated from research, and how that should be operationalized to benefit the public. So community and public engagement sits at the intersection between those two paradigms. With regard to COVID, just want to highlight one thing, that we've been in a lockdown. The whole nation has been in a lockdown, and not just Uganda, but the whole world has been in a lockdown. And what we've witnessed, at least from countries other than Uganda, is that when the lockdown has been lifted, when there's been an ease, and that ease is in fact many times warranted for economic and other reasons, but when there's been that lifting of the lockdown, the easing of the pressure from the population, people then start to interact. When they interact, the risk of transmission becomes a little bit higher when people gather in large masses. And I don't want to mention places, but any gathering, think of any gathering, for as long as people are there in large masses, the risk of spreading infection from person to person actually increases. So, so the challenge then is, in fact, Uganda has about two challenges. Mm-hmm. On one hand, we've been successful in controlling the number of infections. The infections we have are still a little bit low compared to what other countries in the neighborhood have, as well as other continents. Mm-hmm. So in some ways we've actually managed to control the new infections. But we are also a culture that may not be privy to a lot of information that we would actually need to make the right decisions.
Let's talk about that information, because as I believe when we get into the research, when you mentioned earlier that you see the scientists then go ahead and help in informing the directives and the decisions that are made, one of the things is that in the last presidential address, he said, well, the scientists have taken a look at this, the scientists have taken a look at that, and they're now thinking we can go ahead by opening this, but with these particular measures. Yes. Now, this particular research and this study that Thrive is taking on, what are the particular areas they're looking at?
So the area we're looking at is actually community engagement, which is what I was talking about. And what we're trying to do is to, first of all, understand the impact of the pandemic and the mitigation measures on the socioeconomic status of the public. So that's one of the broad aims. We want to look at the impact of the pandemic and the mitigation measures on people's lives.
Because I was about to say, when you say socioeconomic, maybe I might be able to understand, but for lately some terms seem to be lost in misinterpretation. So when you talk about socioeconomic impact, what are those areas?
So we are looking at people's lives and livelihoods. So by that I mean, if someone was seated at home, were they able to what extent were they able to access food? To what extent were they able to access healthcare? To what extent were they able to go to work and earn some money? To what extent were they able to, access some, kinds of social services? So we're looking at impact on all these, issues. There are people who have mentioned that, you know, they were not able to go to hospital when they had. So what was the, would like to understand the impact of that, and all this information could in fact inform government. But that's one broad aim. The other broad aim is to look at whether enhanced community engagement, accelerated, enhanced, enriched community engagement can in fact improve people's propensity to take up the government mitigation measures. People have argued that when you use a top-down approach in pandemics of this kind, they are important. But one also needs to reflect on how communities can be engaged and how communities can actually be empowered to understand what is going on, but also to appreciate the risk issues. And when they appreciate the risk issues, they could perhaps go ahead and on their own implement some measures which are sustainable, using locally available resources. They could implement some measures which could actually help them protect their families and loved ones from the pandemic. So we're also interested in exploring that issue. Can community engagement, or to what extent could community engagement in the context of a pandemic, improve the likelihood that people will take up, mitigation measures? Because the challenge is when you open up, I would like to use the term opening up the country. When you open up, when you lessen, the pressures, people start interacting. The masks are put on the side. Social cohesion becomes the norm. People interact in closed spaces. Then what that means is, if someone introduced, a virus in that mix, then you're bound to actually get more infection. So what we're trying out is there a way we can work with communities so that they themselves can come up with some kind of intervention that they could implement within their own communities, and then intervention that is aimed at enhancing, the uptake of mitigation measures, and perhaps that doing things that way, in addition to the top-down approach, approaching from the bottom up, could perhaps also, improve the response. That's the other question that we are.
When you actually speak of the bottom going up, a number of people say, but do we really need to have this research if at all? You can see that from social media. We have said this is because that's now where a place where many have found a place to express themselves, express their disgruntlement to a number of measures that have been put in place to help curb the fight of COVID-19 within the country, the spread, I beg your pardon. So taking a look at how this community engagement will happen, because some people would say, but our thoughts are on social media. Get them from there, and also just the willingness of the community to engage in this.
So social media is extremely important, and there are people who actually have in this population who have access to social media, who can afford MBs, people who in some ways have smartphones. But if you look at the smartphone penetration, I don't think that's very high if you look at it in the wider country context. But also if one looks at ability to afford MBs, that's another arrangement altogether. People might have smartphones, but there are also skills that are involved. Some people may not have the skills to engage on social media platforms in ways that others could. Others use only some components of social media. To get the point home is you also need to actually go down to the communities and to make sure that whether someone has access to social media or not, they are able to articulate these issues, and that their issues can be heard. But let's not forget that what we are actually doing is research to understand the issues, to understand the impact. As Thrive, what we're trying to do is to understand, we're a capacity building program, we're a research organization. What we're trying to do is to do research on this issue of COVID. What is the impact? That is one aim we're trying to achieve. What is the impact? What has been the impact of COVID on people's lives and livelihoods? Number two, is there a role for enhanced community engagement? If one decides some kind of community-owned risk communication intervention, can that improve people's perception of COVID? Because what's happening right now is there are a lot of conspiracy theories, and many people feel that we actually don't have COVID, which is wrong. Because you know, they don't see the cases in their communities. They don't see, you know, people want the, would have perhaps seen maybe, it would have been easier if someone had seen maybe someone in their community with COVID, you know. But part of the success of this campaign is also turning out to be its greatest undoing. It's happened before with vaccination, where, you know, when people were vaccinated to a point where the infections of measles and other illnesses were actually very low, people then started questioning the role of vaccination. So the success of vaccination became actually a bit of its undoing. Part of what we're seeing now is because of the government mitigation measures, among other things, because of those measures that were taken by government, we've had reduced infection. Now, as a result of that, people are questioning whether COVID actually exists anywhere. And there are a lot of conspiracy theories, you know, around COVID. But how do you address those? You can't legislate them away. You can't wish them away. You need to interact with the communities down there, understand where those sentiments are coming from, where those thoughts are coming from, and then try to, you know, address it from that angle. And the best way to do it is using methods of engagement. You go down there, interface with communities, understand their issues. Where are they coming from when they say COVID does not exist? Where are they coming from? And then once you understand that, you can then deliver your message in a way that perhaps would be better understood if you use means that the communities, you know, understand. So what we're trying to do as Thrive, with the little monies that we receive from government to do this research, we would like to be able to understand the issues down there and explore them, but also test out this intervention. The World Health Organization has also learned, one of the learnings, one of the lessons that they've had from the 2014, 2015-16 Ebola epidemic in West Africa was that community engagement is extremely essential. Yes. These top-down approaches are nice. However, one also needs to reflect on how we can empower masses. You've heard of health workers being lynched, you know, in places, being stoned, being, you know, accused of being the ones spreading. Where does that come from? Part of it comes from the fact that sometimes when scientists do research, they're in their labs and they stay there, you know, and then they bring this intervention which they discovered from their labs. And they're like, oh, but we've proved it works, you have to take it. That's not how things work. The community needs to understand that there is research going on, number one. How relevant is that research to them? They need to be involved. Once you involve them in research, they participate. They could participate, you know, by giving their views about, you know, an issue that one could be doing research about. They could participate in the evaluation to the extent that they can. Once communities are involved, they tend to trust those interventions better.
When you speak of community involvement, definitely this research study will not be able to go countrywide, the entire country.
No.
So every district.
No.
So where exactly will this research be done so that those who at least are watching and know, okay, you're coming here, and I would love to actually tell you how this has impacted my life and the life of our community. Yeah.
So for now, because of the logistical challenges that usually come with small budgets, we've settled for testing out these interventions in Kawempe and Nakawa. First of all, Makere is within Kawempe, but it also has an arm in Nakawa because of mobs. So we thought that it's reasonable to start out in communities where Makere is. It's pretty much in the backyard for logistical reasons, but also for the reason that, you know, these communities are close to us, but they're also affected. And these are also communities where you are likely to find all kinds of sections, you know, of categorizations of people. You have people living in slums, and it's difficult to exercise social distancing, you know, in places like that. So we're interested in finding out what do the communities think can be implementable in places like that. But there are also communities, you know, where there's a bit of planning, they're semi-planned, and there are also communities which are, you know, pretty well planned in both Nakawa and Kawempe. I would like to examine this matter along those strands of communities.
Okay, so definitely we'll be, I think, having a conversation later when the research results, we
Yeah.
can call them that, are
Yeah.
revealed,
Yeah.
and we'll see a way forward. Well, that was our conversation with
Mm.
Dr. Daniel Samakula. Thank you so much for joining us on Morning at NTV. And that does it for Morning at NTV
Thank you.
this Thursday morning, the 30th of July 2020. Now, later on today, we will be having the Minister of Health addressing the nation on COVID-19. That will be happening at 11 a.m. and on NTV we'll be airing it live. What's coming up next is Mwasa Zemutia with Farida Nakaziwe. From us to you, have a good day and stay